to my channel. Thank you for tuning in. So today let's talk a little bit about the past 3 years. Wow, I cannot believe I've been practicing for 3 years or almost 3 years. One thing I can tell you guys, the time just goes by so quickly. It's crazy. And that's one of the reasons why I'm always telling people who message me about how long it takes to get to where they're trying to go. You know, I want to be a nurse practitioner. It's going to take at least 8 years plus the prereqs. The time is going to pass anyway, and it goes by really fast. Like, I feel like I just graduated last year. So, you know, just let it go and do what you want to do and just forget about the time, because it's going to pass by anyway. So today we're going to talk a little bit about what I've been doing for the past 3 years and how I feel. Like, how do I feel now? Okay, so I still feel like a new nurse practitioner. I'm still a new nurse practitioner. Guys, when you think about when you first became a nurse, I mean, it took at least for me 5 years to really feel confident. I do feel confident in some areas. Now, I still feel like I'm a novice nurse practitioner, and that is okay. I'm not rushing. There's no finish line, and I'm not rushing to say, you know, I'm confident in everything. Those people scare me that are just a little bit too confident. I have no qualms about asking questions. I still ask questions. I still ask lots of them. As I told you guys before, at the very beginning of my career, I have a mentor. I have someone that I can send a message to whenever I need to, and she answers me. She helps me, and she's never judgmental. She never has been, and I thank God for her. My prayer for all of you new nurse practitioners out there: find someone, at least one person that you can call when you need to ask a question. If there's no one right there by you that you can ask, I do make sure that when I'm asking questions, it's something that I really need help with. You know, try to do the research on your own first. Try to look around on your apps, look in your binder to find the answer, and just get as much knowledge as you can before you ask a question. And I think that's the key, to let the person that you're going to with a question know, like, hey, I researched, and this, and this is what I found. And if you weren't here, what I would do would be this, and this. Now tell me what you think. And a lot of times when I ask her questions, I will say, well, wait a minute, wait. Don't tell me the answer. Let me tell you what I would do if you weren't here, and then you tell me what you think. And she loves it. And I love doing that because I want to know if I would have made the right decision. So even in clinical, you can use that approach. And I feel like that approach just basically lets the person that you're going to asking a question know that you've put some work in too, and that you're not just being lazy, like, hey, what's the answer to this? And so, you know, anyway, that's my 2 cents on that. When you get out of school and you find a job, you know, look around, feel around, because we get vibes from people. And find somebody that will kind of sort of be your mentor. My mentor at work, I've told her she's my mentor, and it just kind of happened. She kind of told me she'd be there for me in the beginning. Oh gosh, I feel like I could cry. And she has been for the last 3 years. And so, you know, I try to do nice things for her whenever I get a chance, because when you first graduate, it is the scariest thing ever. And if you guys go back to my video, my 1-year video, 1 year as a nurse practitioner, just the transition from bedside nursing to advanced practice nursing, that in itself is just, it's a lot and it's overwhelming. It's exciting, but it's overwhelming. And you just need to have someone that you can confide in, and someone that you can ask questions, and someone that you can kind of collaborate with on difficult cases. That may not be the case for everyone. Some people may get out and they're just like, you know what, I'm confident, I'm fine, I don't need any help. So this is my story and how I look at it. And I just, I feel like a new nurse practitioner should just have someone that they can go to. You may not need to. You may end up not ever needing to ask that person a question, but it's still good to have that on hand. It's just a sense of relief for yourself. And then have your binder. Because my binder, I still use it every day. If I did not have it at work, I would feel so incomplete. Even though I have my apps, you guys have seen my app video, even though I have my Epocrates and I have my UpToDate and all of my wonderful apps, the Sanford Guide and all that stuff on my phone, I love it. I need that stuff every day too, but I also need my binder. I just have my quick references in there, and I put things in, I take things out as my needs change. So in a nutshell, the last 3 years have been amazing. I have learned a lot. In a federally qualified health center, I do pretty much everything. I am in primary care. For those of you who have followed me for a while, you know that I'm a family nurse practitioner. So I see patients from, my youngest patient was 3 days old, and my oldest patient is in his 80s. So yeah, it's very interesting. And if you start out in a federally qualified health center, you're going to learn a whole lot, which is good. You're exposed to everything. One piece of advice I would give to new nurse practitioners, let's see, how do you make it through the day? So when I first go in, I open up, the computer, and I'm kind of looking to see who sent me messages, my patients that may want medication refilled, or they may have an issue with a referral or something like that. So I check that and make sure there's nothing pending that's really important. Then you want to look at your documents to see what has come back, like mammograms or colonoscopy reports or x-rays that you have ordered. Of course, you want to check your labs. So for me, going in an hour or so early, I don't always get to do that because sometimes I'm too tired, but at least an hour early, just to get myself together and to kind of review and just get prepared for the day. I'm the type of person that needs to be prepared. So let me tell you guys my weakness over the last 3 years. What is the main thing I've struggled with? This will help students and this will help new nurse practitioners, because maybe you guys can learn from my mistakes and the issues that I'm having, and maybe you won't have them. You can maybe try to prepare yourself to prevent this issue since you will know about it. And yeah, so the main thing that I've had an issue with over the past 3 years, the number one thing, notes. Locking my notes. I've talked to you guys about this before. I've gotten better. I've improved. And the next time I talk about this, the next time I do a video on this, I'm going to tell you guys that it's no longer a problem, because you guys know how I am about weaknesses. And once a weakness of mine has been identified, then it's almost like I have to work on it to fix it. I have to master that. But let me first of all tell you guys the problem. The reason why I have issues with locking my notes is because I am a perfectionist. I want to have a note that when you read it, it's almost like you're in the visit. I know that that is uncalled for. And I know that I don't have to go that far. I know these things. But even as a bedside nurse, my notes were intense. My notes were very descriptive. They were long. And I know that length doesn't mean anything. It's just I am wordy, and I'm wordy when I speak, and I'm wordy when I write. And that's something that I'm working on. My issue is basically documenting too much and being too detailed. And when you see a lot of patients, you really have to prioritize your time, and you have to balance things out because you will be doing notes on the weekend. Yeah. So the next time I talk to you guys about this, it will no longer be a problem. Anyway, how have I started to correct the issue? Shortening my notes and just being more to the point, more precise. Just using the tools you have with the system you have. You have to use those tools to your advantage, and I realize that. So some ways that I'm overcoming this, my mentor at work was telling me that, you know, come in a little bit early and look at your schedule and kind of just go over who's coming and, you know, kind of make a plan. So before you see your patients, you can kind of make notes on, you know, what you would need to do, what immunizations you would need to order. Do you need to have a referral for a mammogram? Do you need to do a referral for a colonoscopy? And you can make yourself a little note. Some systems have a little notepad at the top, and you could make yourself a little note as a reminder so that when that patient arrives, you already know, like, oh yeah, I don't want to forget these things. So that's a good thing to review and just know who's coming in, and you may have a little idea of some of the things they need. So that's a good way. And also not saving all of my notes until the end of the day to lock them. I've gotten different feedback from different people on how to lock your notes. So some people or some providers will see 3 patients, lock the 3 notes, and then see 3 more, lock the 3 notes. Some providers will see a patient and, you know, they're doing the note while they're in the room with the patient, and they're conversing with the patient. So while the patient's talking and giving, you know, and talking about their complaints and their concerns, the provider is actually documenting the visit, documenting what the patient is saying. So of course you can't, you know, while the patient's talking, but you can type a little bit and listen, you know, type a little bit, click a little bit and listen, you know, and then after that, of course, you're done with the computer and you start doing your physical assessment. If you're nervous about locking notes because you're feeling kind of hyper, you're seeing all these patients and everything's going a little crazy and you don't want to miss anything, you could put like some little sign on your note to let you know, I'm pretty much done with this note. I just want to look over it one more time before I lock it. And I think we have the ability to have a little check on the end, and sometimes I will put check marks on the ones that I'm pretty much done with, and at the end of that session, because we had the morning session and the afternoon session, I will really quickly look over my checks, and if everything's good, then lock them. So different things you could do. My advice would be talk to your mentor, and if you're a student, talk to your preceptor about how they get through the day, how they get their notes locked, and how they manage their time. And I've talked about this before, and the reason why I'm bringing it up again is because out of everything that I've gone through in the past few years, this would be the most difficult for me to master. And I don't like saying that because I can master anything. So, but Yeah, I would say this has been the most difficult thing for me to really catch on to, but I'm more determined than ever to get this under control. So yeah, and I mean, within the last month, I've done really well. I've done really well because at one point my notes got kind of out of control. But yeah, I've been doing pretty good with it, but I don't want to say I've mastered it yet until, I've really mastered it. So I'm working on this. I do still come home from work and look things up that I feel unsure about. When I experience something that is new for me or something that made me feel uncomfortable, I still come home and grab my books and I'm really researching something that made me feel uncomfortable or something that I felt like I should know more about. With that being said, I will say again, keep your books. Some people choose to sell their books. It is a personal decision. I kept all of mine. So I still love to use my primary care guide. This is edition 4. Keep in mind that I graduated 3 years ago. But this book it's everything. You can still see all of my highlighted stuff. It's just really in depth. And I'm actually going to use this between tonight and tomorrow because I want to look up chronic kidney disease and staging. I just want to read the whole thing. I want to go from the beginning. And that's what I love about this book. And you don't have to get this book in particular. Just use the primary care guide that you got when you were in the NP program. But what I love is just how in depth it is. I think I've told you guys before, it just starts with definition and epidemiology, and then it goes through the pathophysiology. Then you have the clinical presentation and physical examination. It goes through diagnostics and differential diagnosis, management and complications, indications for referral and hospitalization. I love that part. I love that it goes through when you should refer or send a patient to the hospital. Patient and family education, health promotion. I love that health promotion piece too because I am all about educating my patients. That's a huge part of my practice. So yeah, so I still use this book, and don't go out and buy this book. If you're in the nurse practitioner program, you're gonna have a book like this. You'll have this book or a book like it, and just keep it. Don't sell it. Another quick reference I use when there's something that I'm unsure about and I come home and I'm just like, oh, I have to look that up. My 5-minute clinical consult. You guys know about this book. I've done a video on it. You can check the video out. I'll have the link in the description box. So this book, I'm not going to go too deep into it, but you guys know I've done a video on it. I love it. This is my baby. This book is just really quick, so if I need to just read through really quick, or if I'm really tired but I do want to look something up, I love the 5-minute clinical consult. So yes, I still use this. I think there is a 2017 edition out now. I have the 2016 edition. This book. Now, I did not do a video about this one. Guys, you know how I am about books. Oh, I love them. I love the way they feel. They just make me happy. So, this book. A student gave me this. We were talking, and then she came to find that I am a bookworm. Before it was her last day in clinical at our site, she brought me this, and I absolutely love it. I use this too when I get home. If there is something that I want to research, that I want to know more about, I do go to this. It really reminds me a little bit of the primary care book, the layout. This one is more condensed and more to the point. If we went with dyspepsia, it kind of tells you some of the hallmark signs. If a person has dyspepsia, epigastric pain or burning, postprandial fullness. So it kind of goes right into essentials of the diagnosis. And then it goes into some general considerations, the etiology, clinical findings. So I really like that. So signs and symptoms, lab findings. Then they go into treatments, when to admit, when to refer, when to admit. So yeah, this book is amazing. I need to spend more time with this. I need to spend more time with this book. I spend more time with you, okay? Yeah, so it's super important to just, like I always say, if you find yourself in a situation and you feel uncomfortable or you feel like, gosh, I wish I knew a little bit more about this, or you just can feel inside that you need to do a little bit more research, then that's okay. I usually put my PJs on and I get in a relaxed, position, either in the living room or my bedroom or whatever, and I get my books and I read, until I start falling asleep. So that's a good practice to have. 3 years later, I still do it. I read a lot. I read something, some medical stuff every day because I have different magazines that come to my house and I like to read. I'm an avid reader anyway, so I actually enjoy reading medical journals and reading my resources. I know, it's nerdy. So, yes, so the last 3 years have been, it's actually been pretty great. It's gone by really fast. For all of you guys out there who plan on becoming a nurse practitioner one day, for those of you who are in the program, for those of you who have graduated and you're searching for a job, just take a deep breath. It's just a lot to take in. Everything is going to be fine. And you just have to take one step at a time with this because it's a lot. When you graduate from the program and you're searching for a job and you're studying for boards and you're trying to make sure that you're prepared to start your job, you're prepared for this huge transition that you're about to make. All of that is just so overwhelming. Just take a minute and breathe because everything's going to be fine. I'm living proof that everything's going to be fine. I did my freaking out the first year. You guys know that. I still have moments, even though I'm 3 years in when I freak out. So before I go, I'm going to tell you guys this. I'll never forget thinking this on my way to work one morning. It was my first year as a nurse practitioner. It was my first year. And every morning when it was time to go to work, I felt so scared. I don't know why. And just in the pit of my stomach sometimes, I would just feel sick just because I was thinking like, what's going to happen when I get there? Like, what type of patients are going to come? What if something happens and I don't know what to do? And I remember driving and I was freaking out inside and I was just thinking, what am I doing? Like, I'm so nervous. And all of a sudden, I just said to myself, stop. At that point, I had been a nurse practitioner for about 3 months. And you know what I told myself? I said, 3 months ago, you walked into that clinic, you saw patients, you survived, your patients love you, you know where to find the answers, you have support, you know more now than you knew 3 months ago. So if you could do it 3 months ago, fresh out of school, and you saw your first patient, and you saw your first 5 patients, and then you saw your first 10 patients, 3 months later, which is today, you can do this. You know more now. And I remember thinking, yeah, I know more now. And I went to work. Once you get through the initial first few days, from then on, you can tell yourself, the first day I knew nothing. Well, you know something because you wouldn't be in the position you're in, but you know what I'm saying. The first day I had no experience, none, and I saw patients. And the second day, and the first week, and the second week, and the third week, all of that's over, and now here I am 4 weeks in. I know more than I did a few weeks ago, or I know more than I did a few days ago. So give yourself credit. Give yourself a chance to grow. And just realize that no one knows everything. Nobody. When you stop learning, you stop growing. So there's always something to learn. And I just want you guys to give yourself a chance and understand that all of the feelings you're having at the beginning of your career are all natural. And everyone probably had the same feelings you're having. I know that I did. I had the fear. I had the, what the heck am I doing? You know, I went through impostor syndrome and I got over all of it. So you will too. I hope you guys enjoyed this video. Stay on the lookout for more videos. I put some links in the description box to some of the other videos I referred to in this video. And I will see you guys in the next one. Love you. Bye.